Down syndrome is a genetic disease that results in an extra copy of the 21st chromosome. It dictates not only the lifestyle of those with the condition, but also the lives of those around them. The condition can be detected through genetic testing, which can lead to a number of choices, including the termination of the fetus. This leads us to several questions regarding one's individual and collective responsibility of how to use the results of genetic testing to determine the future actions. Essentially, do we have the right to decide who lives and who dies? And at what point does this become unethical?
Through prenatal testing, we are selectively targeting disabling traits, such as Down syndrome. Thus, we are ignoring all of the other human values that express us to be unique individuals, and this relates to synecdochal concerns, whereby a singular characteristic, in this case a singular extra chromosome, defines an individual, as illustrated by the expressivist argument. Would this be morally correct? Should we end a potential life on this basis alone? Non-secular individuals will disagree, claiming that only God should have the ability to give and take life. It is unethical to pick and choose dependent on societal expectations. However, if we do believe the opposite to be true, we will acknowledge that measures of eugenic purity policies perpetrated against the Jews and handicapped to be perfectly valid.
A woman should be able to choose. It is she who is physically pregnant for the entirety of 9 months. The emotional and physical responsibility of the unborn child lies solely in her hands, hence the decision to terminate or not. It's a fundamental right. Removing the choice of this decision would transgress basic rights. In doing this, patient autonomy is overridden. This negates core medical ethics. The prima facie of medicine is to do no harm, both physically and psychologically. Thus, by allowing a woman to endure such a burden would defy this principle, and by extension, an integral aspect of her role as a medical professional.
There is a common misconception of what life with Down syndrome is like, assuming a normal life cannot be achieved. But how do we define normal? What may be considered abnormal according to societal expectations may be considered normal for those with disabilities. Therefore, we have no right to determine what is and is not normal. The stigmas about what the quality of life is like for disabled children and their families are not based on data. This is reinforced by the review of a study carried out by 3 disability researchers in the Hastings Center Group in the US, which concluded that the adaptational profiles of families that have a child with a disability closely resemble those of families that have a so-called normal child.
That being said, the Hastings Center study emphasized how parents of children with disabilities find meeting everyday needs is more time-consuming and demanding. In theory, whilst the beliefs of in the end we are all the same promote wider inclusion and positivity towards all individuals, we cannot deny that we are all unique individuals. A child with Down syndrome will always be different to a child without. The constant hospital appointments, the fear of independent future, and the inability to grow up to support themselves, and constant subjection to social perceptions of their condition is an unavoidable burden of this condition.
In conclusion, we believe that it would be impossible to exact a singular point of responsibility. There is a dangerous balance between allowing society to have enough responsibility, deciding who is or who is not worthy enough to live, and having adequate autonomy and freedom over our own futures.
And this is especially dangerous with regards to disabilities such as Down syndrome, where on one hand, if we allow disabilities to be terminated as we see fit, we risk implications of them being seen as lesser to healthy people.
However, not doing so takes away a mother's fundamental right of choice, and this can occur at her detriment. We would say responsibility lies in a number of hands. The mothers for ultimately having the final say, the family for influencing her views, genetic counsellors for being responsible for providing the family all the information to come to an informed decision, and even our collective society, which undeniably influences the actions of everyone around us.
Thus, in this situation, only by case-by-case evaluations should Down syndrome act as a means for abortion.